Hi, my name is Grace Reese. I am a 7th semester nursing student, and today I will be demonstrating the nursing skill of inserting a nasogastric tube. So before I want to begin, I want to know my patient's gag reflex, how mentally aware they are, if they have any history of surgery or a deviated septum, and which of their nares is more patent. Hi, Mr. Jones. My name is Grace. I'm going to be your nurse today. Today we'll be inserting a nasogastric tube, which is a tube through your nose into your stomach. I'm going to perform hand hygiene and provide privacy. And Mr. Jones, can you please verify your name and date of birth for me? Thank you so much. I'm going to wash my hands and put on gloves. And first of all, I'm going to look at Mr. Jones's nares, and I'm going to do the left one because I think that one looks a little bit bigger and like it would be less painful for him to have an NG tube inserted there. We have a 12 French NG tube. Normally this would be in a packaging. Mr. Jones, this is a tube that I'm going to put down your nose into your throat, and the best way you can help me is to listen to my directions and then take sips of water and swallow when I tell you to, okay? Do you have any questions? And if Mr. Jones has no questions, I'm going to raise the bed to working height. And I also want to make sure that he's sitting up nice and tall. And I also would like to give him a towel over his chest, just so we don't get anything on him. Next step is I want to know how far I'm going to insert my tube. And so I'm going to measure from the nose to the ear to the tip of the xiphoid process. And for me, that looks like that's about 30. So I'm going to take a piece of tape and put it on there so that I can remember that. So now that I have my NG tube taped, I'm going to look and make sure that I also have this end clamped so that anything that's in the stomach doesn't just come out all over the place. Mr. Jones, I'm going to hand you some water, and when I tell you to, I'm going to need you to take some sips and swallow with me, okay? So I have my gloves on. My next step is to pour some lubrication in here, and I'm going to lubricate about like the first 4 inches of my tube, and kind of coil it up so that it's soft and it doesn't scratch his throat on the way down. And then I'm going to insert the tube kind of in towards the center, rotating it towards the other nostril as I go 180 degrees. And once I reach the oral pharynx, I'm going to stop, and I'm going to have Mr. Jones put his head forward and have him take sips of water and swallow. About every 2 to 4 inches that I'm inserting the tube will require him swallowing a little bit of water. So if I met resistance here, I would take the tube out and I would re-lubricate it, and I would try to do the other nostril. And so as I'm going, we'll say that I've reached my 30 mark because it doesn't go all the way down on this mannequin. And I'm going to check the back of the mouth because I want to make sure that it's not coiled in the back of the throat. And say that I'm happy and that it's not in the back of the throat. I take another piece of tape and I secure it here just really quickly. And then I'm going to check placement. So the X-ray is the gold standard for checking placement. But another way you can do it is to aspirate the stomach contents. So I would take a big syringe and I would uncork it and I would aspirate stomach contents, and I would check the pH to make sure that it was not in the lungs or somewhere else in the body. And another way I could do it is I could take the syringe and put it in here and I would listen over the epigastric region as I inserted 10 to 30 mils of air, and I would want to hear a whooshing sound as the air entered the stomach. Assuming that our placement is correct and that Mr. Jones is still doing okay, I'm going to take a piece of tape here and split the ends. And I place this piece down the bridge of the nose, and then these pieces I wrap around the tube, like so. And then I can also take a piece of tape or a safety pin, and I also want to pin it kind of off to the side here to the gown, just so that it's not rubbing or pressing on the nose here. And my last step is I'm going to want to document. I want to know how Mr. Jones tolerated the procedure. I'm going to want to know what the contents look like that came out, what was the pH, how did I decide to go on use the Nair on the left-hand side, and then I'm going to want to make sure I know like his oxygen saturations and gag reflex after as well are still doing okay. And then, so I'm assessing him. He seems happy. I have everything documented. So that is it. Thank you.